Muthinyani wa umuthi Kitui Times TV ni tukwithwa twilika sivitalini munene wa Kitui Referral Hospital ni kana twisie uthukumi wa Cancer Center na ila inekiwe unguo utongoi wa serikali yake Dr. Julius Malombe na ila yavinguwe twi matuku 30 mwai wa 11 mwaka muthelu wa 2023 ni kana tumenye uthukumi wa Cancer Center na ila ikwithwa iyokoa kana kutethesia nthi na kalima county ya Kitui na ala kavindani kala endomo ila methwano wa cancer mana lasimika kumantha witi county ni ya Masaku kana kuthilo vinange kuthi nthi cianza ta India indiwe governor wa county ya Kitui Dr. Julius Malombe ona ni useo kumetana enenthi ma Kitui na kumaete Cancer Center vakuvi namo kwatania na kwa Francis Mulo wa Kioko ni kana tutambanie imoko imwetu like tuelewe ni matakitali mena utuika yulu wa Cancer Center hii apanga sile mishali undu ikethia wa idhukuma mwene nthi na kuikethia wa cancer ni wavikia na umandhika mituki utana vika stage ile tatonya kuiteka ni kana mwene nthi ukavikia na kuitwa na kuvua wa cancer.
Project was successfully implemented in collaboration with the country government of Kitui, Bristol Squibb Foundation, the Cataract Mission, Medical Mission Board, and the National Cancer Institute, Kenya.
This cancer registry has been documenting our cancer cases in the county since 2019. This was established in partnership with the CMMB by the county government of Kitui, and we already have the documented cases for the Kitui county for the cancers, but we have not yet been managing them. We are going to start officially with this building. This is our second room, and this is our triage. Our staff are already seated here. So once the patient has been received, medical records registered in the hospital, first they are seen by the nurse on this, and then the nurse identifies which area are they supposed to go from here. This is our first consultation room. Here we have the clinical officers who have specialized in oncology. Already we have 2 trained clinical officers who are seated here, and they see the patients once they have been seen by the nurses at the triage desk. This room. This is our consultant, clinical oncologist in the hospital, and this is our room where she sees the patients once they have been seen by the CEOs and the nurses. And her name is Dr. Such. Maybe I give her an opportunity to say hi. This is our pharmacy, oncology pharmacy, and we have our clinical pharmacist who is trained in oncology. And this is where now the patients are supposed to get drugs. Through the support of the county government, we already have drugs that are set, and the patients are ready to receive drugs from tomorrow. Yeah, thank you. So this is our mixing machine. It's the prerequisite for any cancer center registered and authorized to carry out services. Here we mix the cytotoxins, which are the drugs used to manage cancer. And this chamber protects both the product, the patient who is receiving the product, and also the environment, because we have filters here which are supposed to see any bad things that are coming, or else contaminated things that are coming from here. In which we have 2 filters, which the first is the second, and then we allow after that, because this is already clean air, we can release it to the environment. So this minimizes the contamination for the patient, for the product, for the environment, and for the worker who is handling the products. So our patients who are on daycare will be receiving chemotherapy from here. We have everything that is required for them to get their drugs safely, in a comfortable environment, in a place where they can even enjoy, such that we don't take them into an environment where they are feeling that they are sick. So at any given time, this room can host 5 patients, but we have 6 chemotherapy administration beds. These chemotherapy administration beds have been certified, such that even the comfort, if you want to turn them to a bed, it's easy to turn them mechanically. And on the other side, we have 1 seat that is also supposed to be here, but because at times we have patients who are at risk of getting infections, we cannot mix them with the other patients. So we have an isolation room, which is our next room.
Maybe the Director can demonstrate how this bed works.
Yeah.
And just turn it, you press here, the patient, it goes up for the comfort of the patient. If the actually he or she is not comfortable, they can also just adjust with this knob. Yes. These are the ones whereby you can adjust upward. Yes. Okay. Yes, you can adjust upward for your comfort. Yeah, you can also just these are modified one for your comfort actually. Yes. And then I think that one we have a patient maybe with a cold compression. Because of the cancer had metastasized to the bones, and maybe you want to lie. This one it makes you to uplift you, and this goes at least a little bit lower. Yes. Yeah.
Thank you.
Yeah.
Cancer Center hii va Kitui ni vikite na konektiwa masivitali 17 makaunti ya Kitui vala matakitali meisioni situ makethia wana utonyi wa unenania imwe kwa imwe kwisila Cancer Center ya Kitui through communication ila ikuita telemedicine na vala matakitali masuspecti mwokwithiwa na kalinyuka cancer makethia wa matonya unenania na kutethesia muusuku kwata witi wa mituki oingi Cancer Center ya Pangasile Mishali ni kwithwa i connectiwa na Cancer Centers ila si Kenya yonthe na nthisi yonthe nikana withie matakitali maitu ni methi wa mainene na matakitali angima kansa na alame na utuika munene kuma nthisi anza na Kenya no kondwa kwikithia muo wa kansa ni wakwata witi museo.
Okay, we need some space there. So just to explain that this is part of the telemedicine for this, not just for this center, but for Kitui. So we are going live. We are connected to 17 hospitals in Kitui, and this is part of learning, part of support to the different hospitals. They are all connected. They have the hardware and the software connected. Something called Project Echo, and this is meant for continuous education and support of people in the different health centers. So as part of what was innovation for CMMB, with CMMB's own funding, we were able to get this infrastructure, and on top of that, get Project Echo to come on board to support this. Yesterday, we had a learning session with some of the centers, the Ikuda, Mutomo, and some people in India. And in future, we'll be able to connect with Moi Teaching Hospital. We'll be able to connect with different centers around the world. And this will, with case presentations and with different medics from different parts of the country, and especially in Kitui, presenting their cases and discussing it with other doctors who are not necessarily domiciled where they are. So I think this is a use of technology that we want to harness to make sure that we strengthen the capacity of healthcare workers in Kitui and around the country. So we are going live. Isaac? We're already live, yeah. Yeah. So I think we are. This is the launch. During the launch of our cancer center, I want to invite the governor and to say a few words. Not a lot, 2-3 sentences, and our president and CEO, Mary Beth, and then I would invite also I will invite Chris. Before we start, yeah. Yeah, and then after that we'll start our session. You can sit for about 5 minutes, and the session will continue.
Your Excellency and delegates, today is a great day for us in the county government of Kitui and also County Minister of Health and Sanitation. We celebrate a great milestone of this Pansile Muchali Cancer Center commissioning. The Cancer Center was put up in partnership with CMMB, funded by Bristol Myers Squibb Foundation. And in this room, we are seeing a technology
Recording in progress.
which was supported by CMMB. And through that, we can be able to get expertise, medical expertise, which we do not have in this county. And therefore, our people will be getting quality cancer services through this platform. This platform is not just for the cancer center, but for the whole hospital and other 14 public health facilities. And this has been done in partnership with CMMB, and we appreciate the partnership and friendship. Thank you.
Good morning, everyone.
Good morning.
I need to say thank you to CMMB for the great work you are doing in our county. Kitui County is going to experience an high-class, world-class telemedicine facility, courtesy of CMMB. All our county hospitals, especially the level 4 hospitals, are going to be connected to this facility and will be able to advise our patients in whatever manner we require. And also, we're going to be connected to the world, the outside world. We know India is one of the best cancer treatment centers in the world, and since the facility is going to connect us with the doctors in India and South Africa and the rest of the world, then our patients are going to get all the services that have been going all the way abroad to seek for treatment that can be done here in Kitui. Our governor has given his commitment that everything that needs to be done is going to make sure the facility runs the way we have planned. The other day when we met with the Vice President, we agreed that the main problem, that challenge that you are foreseeing is the support of this facility, the entire cancer center. And the governor made it clear that he's going to make sure everything is going to be supported by the county government and the budgetary allocation is going to be there. So let's serve the people of Kitui and welcome this gesture from CMB. Thank you.
For me, Your Excellency and other honored guests, I'm really delighted to be here for CMMB. This is a very high priority. We've had a wonderful partnership with the ministry here, with the Ministry of Health colleagues and with the hospital to improve maternal and child health. But this continuing issue of how we address chronic diseases, non-communicable diseases like cancer is very important to CMMB, and we are greatly appreciative of the partnership with the ministry, with our colleagues from Bristol Myers Squibb Foundation, and Your Excellency on really paying attention to some of the most important and treatable causes of cancer that are taking women far too early. So I'm grateful to be here with all of you today for this important celebration.
Yeah, Christabel is head of BMSF Africa, and she's not just our funder, but for this project, we co-created this project with her. She was involved in literally in guiding the writing of the proposal, and some of the things that you see within our cancer project, she was at a very detailed level involved in it, and we appreciate her for that. Kristen.
Thank you very much, Your Excellency, all protocol observed. I just want to greet everyone. It's my first time in Kenya and I feel so welcomed. I just want to say thank you for all the welcoming, warm hands. It's just been such a pleasure to see this concept that we developed as Dr. CSS. We developed this concept to something that is concrete. It's just been a momentous event in my career, something I'll never forget, and a moment that I'm very proud to have been part of. I wish all the people in the center well. I know you're going to do well. The tour was amazing. The center looks great. And we're here to support you going further. I know there are further aspirations you have, and we look forward to partnering with you to help make some of those materialize. So with that, I say congratulations, and we look forward to a very good day.
So I think something.
Thank you very much, Your Excellency, our founders, UNICEF and CMMB. We are proud to have this facility. We'll be able to consult with the doctors, specialists who are within the country and outside the country, and we are taking pride in this. We are already, you can see, we are connected with our hospitals within the county, and we are sure this cancer center will not just serve patients physically here. We'll be able to advise our patients who are away, but within the county. So we take pride in that, and we invite you because we had a brief session here, and we thank you for creating time for that. And we pray that even in future, where we have challenges, connectivity, we will be able to facilitate us to be able to reach those 14 level 4 facilities, such that we preach this message of about cancer, NCDs, and the other diseases that we want to give priority as a county. I've just been given a special request, Your Excellency. Once we are done with this, in the next less than 5 minutes, you give us 2 of your minutes just for a small documentary for CMM. Thank you very much.
Okay, so you can continue with the tour. I will get started the session. I will start the session. We're having a session on cervical cancer, where we're having a discussion with all the hospitals. His presentation and discussion thereafter.
For medical social workers who are very key in cancer program, and these are patients, the staff who help us.
Chini kuzuia wageni.
So the very first key team in cancer treatment, we have the social workers who are supposed to link us, sort out issues with the socials for our patients who cannot afford care, patients who need to be assisted by the county. This is the team that helps us in that. Then from there, I want to hand over this
where the cassettes are cut and the tissues are put there. Then after the microtomy, then they're taken to what is known as the staining table, so that the slides get stained and then you can therefore report. That's basically the process. So from here, it's basically the processing of the tissue Then in the other room, the sustaining of the slides. Then after that, the first room where I was is the reporting of the slides, where we can release the report of the patient.
Thank you, Your Excellency. This is the first lab, pathology lab. We have adequate staff to start the work. As I've mentioned, we have the only clinical pathologist here in the county. We'll even be receiving slides from other areas to report for them. And we are proud because this is a facility that our patients have been sending them away for cancer diagnosis. This is very key because even in early stages, we'll be able to detect the tumor. The ones who are supposed to be managed surgically, we have surgeons on board. The ones who are supposed to be managed with chemotherapy, you have seen the mixing chamber drugs. And the ones who need radiation, these are the only patients that will be able to send. So we are pleased to meet with and have been given by our partners and the county government. Maybe in the future in our days, we'll have radiation oncology. We have the complete cascade of care. So this ends our tour in the cancer center, and we appreciate and thank you for your time. Again, I still request for your 2 minutes for just as a brief documentary for the Cabinet Commission. Thank you.
Representing His Excellency the Governor, Dr. Julius Malombe, on this great day when we are unveiling the Pangisile Charlie Cancer Center. The name is derived from the lady who initiated the process and fundraised for the construction of this cancer center in collaboration with the CMMB, where the county government has given its contribution towards the project, and CMMB has also done their contribution towards the project. And today we are witnessing the launching of the project, where we are going to have a new modern cancer center in the region, fully equipped, fully operational, with all the medicines, and we also having a telemedicine unit that's going to serve the entire county and connecting the county within Kenya and outside Kenya, where consultation can be done with other doctors outside the country and within the other cancer centers in the country. But today marks a very big milestone for the people of Kitui. All the level 4 hospitals in Kitui, the 14 level 4 hospitals, are going to be connected to this unit through the telemedicine. It's a program which has been fully funded and by the CMMB, that is the Catholic Medical Missions Board, and we thank them for everything that they've done for the people of Kitui. So, ladies and gentlemen, I take this opportunity to say thank you on behalf of the people of Kitui to CMMB, the president. Thank you so much. There's nothing that can pass what you have done to the people of Kitui. Thank you so much.
And what plans to sustain this project?
One thing, the county government is going to make sure there is a budgetary allocation for this facility so that it can run smoothly. Already the county government already stopped the necessary drugs, and treatment is going to start immediately. So there is nothing that is going to stop the cancer center from running. We're also training more doctors and other staff so that it can run smoothly. Thank you.
Maybe you can have a word from CMB.
Representatives of the government and Bristol Myers Squibb Foundation are partners in this project to ensure that women have cancer treatment, that there is good screening, that this is something that is addressable, and we don't need to wait until it's too late. So for us, it's a great honor to be part of this project in partnership with our ministry counterparts as well as our other funders, and ensure that women get the kind of treatment that they need here in Kitui County and beyond, and to connect Kitui County with other physicians outside of Kitui County who can help with complicated cases is really important.
Today, I'm just so proud to have been here to witness the opening of the Pangisile Mtshali Cancer Center in Kitui. It is such a great honor for the foundation, and it really just marks what a great warrior she was in the fight against back then HIV and AIDS, and now cancers. She was a very, very strong woman that stood for the rights of women and children and the health disparities across the continent. So it's really, really an honor for me to be standing here to witness this and to really take this back home to the people, to say that back in Kitui there is a Kankisile Mtabi Center that was dedicated to her, and her memory will live on for many decades to come. That this partnership is just beginning, and we really hope this makes such a difference to the whole Kitui, but also the Kenyan country in totality. So thank you very much.
Yes, from the National Council. Your word and experience.
Thank you so much. I'm Dorothy Nyongo, County First Lady of Kisumu, and I bring you greetings from Kisumu County, from the Governor, Professor Anyang' Nyong'o. We are really impressed, and thank you CMMB for doing this and for inviting us. This is such an impressive project, and I think all the other countries will learn from this. This is such an amazing partnership. Thank you CMMB and Bristol Myers. The partnership is going to take this region places. Yeah, it's so important to have screening for early detection of cancer. This gives people an opportunity to live, to have a life after cancer diagnosis. So we really encourage you for this project. Thank you so much.
Uthuthio ni kwa kuwe mwene nthi wa kaunti ya Kitui waseitambia na kukava Kitui Referral Hospital ni kana wikwe early screening nthini wa Cancer Center, ni kana umandikane kana wina wo wa cancer kana ndwina wo wilikana kana wamandikana wo wa cancer tene nuvikia na kuitwa na kuvua. Inde ando ingi kitumi cha kuithwa mate kuitwa na kuvua ni kuithwa mekala muno kanza ino ikavita stage ila itatonya kuitika. Osevso usembe va Kitui Referral Hospital ni kana wikwe early screening nthini wa Cancer Center.